Here's how to properly inject your Mounjaro pen. I'll walk you through every single step: uncapping, unlocking, injecting, and safe disposal. Then I'll reveal the 7 critical mistakes that are costing patients thousands of dollars and causing incomplete dose administration. The number one mistake, it happens after you press the button. Mounjaro's auto-injector, it's different than Ozempic, so let me show you exactly how to do this right. This one Mounjaro mistake is costing patients $500 every single month. Removing the pen after the first click, you're literally getting half the doses without even knowing it. But that's just one of 7 critical injection errors destroying results. By the end of this video, you'll know all 7 mistakes plus the exact technique that'll guarantee your full doses every single time. If you're new to my channel, hi, I'm Dr. Jones DC, and I lead the coaching department where I've trained thousands on proper GLP-1 techniques. What I'm about to show you isn't in the patient pamphlet, but it totally needs to be. All right, let's get everything ready. Your Mounjaro pen, alcohol swabs, cotton balls or gauze, a sharps container for disposal, and your phone for timing. Now, here's what's different, and this is huge. No separate needles needed. The needle is built right into the pen. That's one less thing to worry about. But before you touch anything else, and I mean this, wash your freaking hands thoroughly with soap and water. In my practice, the few injection site infections that we've seen, almost everyone, it's from skipping this simple step. It takes 20 seconds. Freaking do it already. Saves you from a week of antibiotics and other issues. With clean hands, you're ready for the next step, and this one can save you hundreds of dollars. Hold your pen up to the light. Look through this window here. What you're looking for is clear to slightly yellow liquid. Think water or very light apple juice. This is non-negotiable. If you see any cloudiness, crystals, particles floating, or weird discoloration, stop right now. Do not use it. That's a dead pen, potentially worth hundreds of dollars depending on your insurance. I had a patient last month, Sarah, who injected cloudy medication for 3 weeks, wondering why she wasn't losing weight. Turns out her pen had been frozen during shipping. Even if it looks normal after freezing, the medication's destroyed. That was a total game changer for her once she figured that out. And check your expiration date and confirm the dose on the label matches what your doctor prescribed. Trust me, these simple checks matter. Now, where to inject? You've got 3 equally effective options, and the research backs this up. Your belly, staying at least 2 inches from your belly button. I measure with 2 fingers, just like this. Your thigh, the front and outer areas, or the back of your upper arm if someone's helping you. What I tell patients is this: the medications get absorbed and distributed through your body's circulatory system. Works the same regardless of which site you inject. Pick based on what's comfortable and accessible to you, and don't let some TikTok video tell you that you're going to get magical injection in one area. Collectively, it's about the same, but you might have individual variances, so try different areas. You might find one that works better for you. Clean your chosen site with an alcohol swab in a circular motion, working outward. Then, and this is key, let it air dry completely. Don't blow on it, don't fan it, just adds bacteria back. Patience here prevents problems later. This is where Mounjaro's design is unique. That gray base cap, it needs to come off before you've unlocked the pen. This 2-step safety prevents accidental activation. Here's your exact sequence and follow this precisely. Step number 1, first pull out that gray base cap and discard it immediately. Number 2, place that clear base flat against your cleaned skin at a 90-degree angle. Step 3, unlock the pen by turning the lock ring from the locked to unlocked position. You'll feel it click. Step number 4, press and hold the purple injection button for about 10 seconds. Step number 5, you'll hear the first click. But here's the thing, you're not done yet. This is where Jessica, who I mentioned earlier, was going wrong. Keep holding that button and count with me here. 1 Mississippi, 2 Mississippi, all the way to 10 Mississippi. Step number 6, listen for that second click. But even then, verify through the window. You must see the gray plunger visible. Both the second click and seeing that gray plunger confirm your full dose was delivered. Step number 7, only after both confirmations can you now remove the pen from your skin. If there's any bleeding at all, totally normal by the way, press a cotton ball on it. Don't rub it. Rubbing spreads the medication superficially instead of letting it absorb deep where it needs to work. The entire pen goes straight into your sharps container. No needle to remove, no caps to replace, never throw it in the regular trash. That exposed needle is a biohazard. Quick reality check from the clinical trials, injection site reactions happen in about 3% of patients. Mild redness for a day or two, that's normal. But if you see spreading redness, warmth, or swelling after 3 days, that's when you call your provider. Now, that looks straightforward enough, right? But here's what most people don't realize. In our practice, I see trained nurses, doctors, and even pharmacists making injection mistakes that waste hundreds of dollars of medications. Jessica, the patient that I mentioned earlier, she's actually a registered dietitian who'd been teaching other people about GLP-1s while unknowingly getting half doses herself. Let me show you exactly what she and thousands of others are doing wrong. The number one mistake, removing the pin after the first click. Jessica was stuck at 10 milligrams with terrible side effects for months. Because of this, she thought that click meant done. Nope, she was wrong. The FDA's data shows incorrect dose administered as one of the most frequently reported issues. And here's why it matters. At current prices, you're potentially wasting hundreds per pin. That's literally like setting money on fire. That first click is just the beginning. Mounjaro is thick. It needs the full 10 seconds to deploy completely. Count it out every single time. Your weight loss depends on it. If you've made it to this point, what surprised you the most about the injection process? Drop a comment below because I read every single one and it helps me know what to cover next. Here's mistake number 2, unlocking the pin before removing that gray cap, or removing it and then getting distracted. Once you remove that gray pin and unlock, you need to inject immediately. I've had patients remove the cap, unlock, and then get distracted, leaving an active exposed needle, or worse, trying to remove that cap before unlocking, which can damage the device. My rule for patients: first, remove that gray cap, immediately place it against your skin, and then unlock. It's a rapid sequence once you start. Mistake number 3, and here's what really gets me. Temperature abuse ruins more medication than anything else. Yes, each pin can survive up to 21 days at room temperature if needed, but here's what most patients don't realize. Heat degrades Mounjaro, even if it looks completely normal. Left it in your car, dead pin. Accidentally frozen, dead pin. Even if it thaws and looks perfect, when in doubt, throw it out. But wait, if temperature mistakes are costing you money, what I'm about to show you next is even more critical. Why do some patients develop resistant zones on their body where Mounjaro just stops working entirely? It's not tolerance, it's not antibodies, it's something that you're physically creating with your needle. And once it happens, that injection site is compromised for months. You've got to hold that pin perpendicular 90 degrees straight up from your skin, not angled, which will be less than 90, like you're writing. When you inject at the wrong angle, you risk hitting muscles instead of fat tissue. What I tell my patients is this: muscle tissue absorbs medications faster with less predictable results. With GLP-1s, we want that slow, steady absorption through the fat tissue, not quick, unpredictable hits from the muscle. Straight up 90 degrees every time. This is non-negotiable. Mistake number 5, the pin won't fire if it's not fully unlocked. Yesterday, a patient called us panicking, couldn't get her pin to work. Turns out she was turning the lock ring halfway, like opening up a medicine bottle. You need to turn it completely until it clicks into the unlocked position. If your pin won't fire after following all steps correctly, stop, don't force it. That pin's probably defective. Call your pharmacy immediately for a replacement. Using the same injection spot repeatedly creates a medical condition known as lipohypertrophy. Basically, it's scar tissue lumps under your skin that can significantly reduce the medication absorption. The insulin research shows up to 70% of patients develop these issues from poor rotation techniques. Now, that's insulin data, but the principles apply. You're creating medication-resistant zones on your body. At this point, you might be thinking, I'll just be extra careful with my technique, but here's the shocking truth. The most expensive mistake I see has nothing to do with how you inject. Yesterday, a patient brought in 3 pins that were completely useless. They looked perfect, right temperature, not expired, no damage, but one simple storage error made them worthless. She'd been using them for 6 weeks, wondering why she regained 12 pounds. Mistake number 7, never, and I mean never, use a medication that's been dropped on a hard surface. The glass components inside can develop hairline cracks invisible to your eye. Same goes for any pin with questionable storage history. Patient left hers in a hot garage for one afternoon, and that's all it took. Several $100s gone. Finito. When traveling, use an insulated case. TSA allows it with your prescription. Never pack it in your checked luggage where temperature extremes can destroy it. Protect your investment. Which of these 7 mistakes were you making? Or maybe you've discovered one that I didn't cover. Share it below. Your experience could help someone else avoid the same costly errors. Okay, quick troubleshooting before we wrap up. Pin won't fire, check that lock ring. See liquid on your skin after? You likely pulled out too early. Contact your provider, never double dose. Dropped your pin, don't risk it. Uncertain about storage? When in doubt, throw it out. You now have the exact technique that we teach in our practice. What I've seen is patients who master this technique often need lower doses over time. They're actually getting their full medication for once. Robert, one of our long-term patients, went from 10 milligrams down to 5, now maintains on just 2.5 every 2 weeks. His words, not mine. I'm in control now, not dependent. Now, this wasn't entirely from injection techniques, but injection techniques definitely contributed among his lifestyle interventions. Remember to work with your healthcare provider on your dosing strategy. This education combined with their medical guidance, that's how you optimize your results. Now you've got this complete guide. No more wasted medication, no more incomplete doses, no more confusion. If you guys want a comprehensive video that goes over the 10 most common mistakes that I see people make on their GLP-1 medication journey, check out that video right there, and I'll see you guys in the next one.